Now, it's one of the most intractable policy problems of our times. How do we best deal with the consequences of drug addiction and break the cycle of offending? Today, the Justice Secretary, Chris Grayling, met with a delegation from the United States, amongst them former addict and sitcom star, the actor Matthew Perry, who think drug courts are the answer. We'll ask in a moment whether they are, but first, what are they? Here's Zoe Conway.
Drug courts? They ain't easy.
Drug courts could save someone you love.
Drug courts are the solution.
There's no shortage of famous recovering addicts to evangelise about America's drug courts. They've reinvented the relationship between judge and offender. Stay clean and the offender gets lots of praise and stays out of prison. It's rather less touchy-feely in Glasgow. Their drug court opened more than 10 years ago.
Anything you want to say to me?
Thanks for giving me the opportunity.
So you got another 6 months to go. So this is where we get into the home straight now. And you finish off. All right?
Yes.
Good, well done to you. I'm delighted for you. Well done.
Thank you.
The key difference between a drug court and an ordinary court is the relationship that builds up between the judge and the offender. The judge is meant to act like a mentor, encouraging and supporting the offender to stay off the drugs. The offender is meant to confide in the judge and tell them how the treatment programme's going. It all sounds a bit happy-clappy, but the judge does have sanctions at their disposal. They can send the offender to prison if they drop out of the treatment programme.
As an analogy, I don't know, you could say a bit of the football manager analogy where, some players need to be told in frank terms and some players need an arm put around them. I've not put an arm around any of them yet. Maybe that's the sort of thing they do in America, but that wouldn't work in Glasgow.
Martin Boyle was addicted to drugs for 20 years and imprisoned 25 times. He says he couldn't have turned his life around without the support of a drug court sheriff.
She was amazing. Even the way she spoke to me, she treated me like a human being. There was no barriers, there was no stigma. She didn't treat me like a drug addict. I shouldn't be alive. I know it myself.
So she saved your life?
Definitely.
What would you say to her now if you saw her?
I've been sorry about this. Eternally grateful for her. And I hope she does get to hear it, or she does get the message, because she was the only person in my whole life that's kind of really gave me a chance.
So how effective are drug courts? A Ministry of Justice study found that offenders were 30% more likely to complete a drug treatment order if they had regular contact with a judge. But the sample size was small. The department admits there's no robust evidence on the impact of drug courts on reoffending. Evidence from America is more compelling. A study there suggests that reconviction rates were 13% lower for offenders who completed a drug court order.
Well, you've sat through the drug court process. Can you describe to me what it looks like?
It's really a place of celebration.
Matthew Perry has been lobbying the Justice Secretary to put more money into drug courts. It's not clear yet whether he'll get his wish.
We've got 32 magistrates' courts in this country that offer the drug court model. Do you think it's now time to expand that?
What matters, I think, in our justice system is what works, and we've clearly got some evidence in the UK, but interesting evidence from the States as well, that there is a potential here to have an impact on reoffending levels. Absolutely central to what I want to achieve in my role is to bring down reoffending rates, and I'm open to all ideas that can help achieve that.
You're struggling right now, but I'm going to persevere with you and encourage you.
Drug courts are intensively resourced. Along with the judge, they involve probation officers, health and social workers. But their supporters argue they save money in the long run because fewer offenders end up in prison.
With us now is the actor and former addict Matthew Perry, the journalist Peter Hitchens and Baroness Meacher, who chairs the UK All-Party Parliamentary Group on Drug Policy Reform. Why do you have such faith in drug courts?
Well, that's kind of an easy question to answer. I see that they work. I see that I've been involved with them for about 4 years, and a little over 4 years, and People that go through drug court have a 55% less chance of seeing handcuffs ever again.
How do you know that these people wouldn't have quit their drug habit anyway?
Well, that gets into a bigger question of whether these people are addicts or not. You know what I mean? If they're drug addicts and alcoholics, then they're going to keep going until something stops them. And drug court is a wonderful way to interrupt that process. And it's a way to not throw these people away. So it takes first-time non-violent drug offenders, and instead of throwing them into prison, it puts them into a 18-month to 2-year program.
What's not to like about it?
Well, the evidence in favour of them is pretty scanty. There haven't been many serious studies. I think one in Baltimore, one in Arizona, and one somewhere else in the United States, and they tend to suggest that over the long term then they don't make much difference anyway, and the selection of the people who go through them I think has some impact on it. But the real problem for me is this, that what you're saying is you're effectively seeking to fail in the criminal justice system. The whole point of the criminal justice system, and we forget this all the time, is to deter people from committing crimes. Once you've arrested someone, once they've appeared in court, it has already failed. And to soften the court system, to make it into a kind of jolly where the judge wears tracksuit bottoms and is nice to the offender. Oh, you should see some of the things that have been going on in this country, the West London drug court, where the judge, as I said, wore tracksuit bottoms and was macy with the defendants. This gives the impression not of the majesty of justice, but of somebody trying to be nice. Now, actually, it doesn't do anybody any favours to try and be nice to drug takers.
There's nothing wrong.
So the problem
there's a great deal wrong with it, because if you want to stop people becoming drug users, then the best thing to do is to make sure they never start in the first place. And an effective deterrent criminal justice system
you're dealing here with people who have started.
Well, yes, because they've started because the criminal justice system is so feeble.
Isn't the real problem?
It's feeble from the start.
Ernest Meacham, you can have a contribution here, come on.
Isn't the problem that by the time you get to a drug court, you've already assumed that drug addiction is a crime? Actually, drug addiction is a health problem. So the first thing you've got to do is some preventive work, prevent people becoming drug addicts, and that we now know there's good evidence that you can do that. Portugal have switched vast sums of money from prisons to treatment. They have vastly more people in treatment than we do here. They have a much better record than Spain and Italy. You can deal with this as a health problem instead of waiting till people become really severe addicts, get into the criminal justice system, and then I agree with you. Drug courts can be a little more helpful.
I'm not understanding your point. Your point is to stop drugs and alcoholism by just people never starting?
Well, you two believe in this fantasy of addiction in which people lose...
Fantasy of addiction.
A complete fantasy in which people lose all power over themselves and become victims of this terrible, frightening disease.
But right now you're quoting...
Let me finish. This is what you believe, this terrible, frightening disease after which they cannot stop taking drugs. If you really believe that, then you would presumably think the best thing would be that they never ever came in contact with those drugs.
Of course.
Wouldn't it therefore be wise to deter them from doing so by a stern and effective criminal justice system which actually persuaded them it was unwise to take the drugs in the first place?
When do I get to speak? I'm dying to speak.
If you really believe in it, you'd agree with me.
When can I speak?
Speak.
Okay, so...
I didn't come here to be quiet.
Neither did I.
No,
I didn't come here to listen to ludicrous things like that either. So
well, you tell me why it's ludicrous if you're so close.
I will. The American Medical Association diagnosed it a disease in 1976, so you're saying that that's incorrect?
Yeah, look, people...
Are you saying that that's
incorrect? The medical
incorrect?
profession is constantly doing extraordinary things. The American Psychiatric Association said for years that homosexuality was
Peter,
a disease.
the key thing is...
They were wrong. All kinds of things
Peter,
are said by medical professionals.
The key thing is we've had this policy for 50 years. We've had this policy
My life.
My
life is the objective
of treating
evidence.
Addiction as a crime. 50 years.
No, we
and we
haven't.
now know that it doesn't work. It doesn't work anywhere in the world. Increasingly in the US, Uruguay and elsewhere and in Europe,
Finish your
things
point,
are changing.
My life is... I'm a drug addict. I'm a person that if I have a drink, I can't stop. And so it would be following your ideology that I'm choosing to do that. I'm choosing...
That's exactly not my ideology, it is my belief. Yes, you do choose.
It is, and
you
it's a belief that you wrote in your book. correct?
You have a choice over whether you drink or not. You have a choice over.
But your book is the only book in modern times that has this ideology.
Yeah.
So doesn't that teach you something?
Well, it's quite often unfashionable ideas are unfashionable because they are unpopular with influential people. Doesn't necessarily bother me. You tell me what the objective diagnosis is to establish the existence of addiction in the human body.
It's an allergy of the body, and it's an
allergies of what?
We're supposed to be grown men here, and you're making faces like the guy who's wearing the pants that you were talking about earlier. I'm expecting you to come out in the pants in a minute. It's an obsession of your mind and an allergy of your body. So this is what happens to me. I start thinking about alcohol. I can't stop. I can't stop thinking about it.
And what's the objective physical proof of this inability to stop?
There's considerable proof this is partly a genetic problem, isn't it?
Your argument is that it's willpower, Peter.
Of course it's willpower.
It's not willpower.
People constantly stop both drinking and taking drugs.
You're just a person who's talking who's wrong.
If willpower were not involved, then how would that happen?
It's an effort of will on your part not to do it now, isn't it?
I'm in control of the first drink. And so I do all these things to protect myself from not having the first drink.
Sure.
But once I have that drink, the allergy of the body kicks in. This is all documented alcoholism proof. Then I can't stop after that.
Our problem with Peter...
I mean, I'm allergic to aspirin, but it doesn't mean I have to drink.
But you have to look at the evidence, Peter.
That is
what is this allergy? It's
an allergy of your body.
It's just
not that your aspirin point wasn't. Not that your aspirin point wasn't genius, but you don't know what you're talking about.
That's right. You've got to look at countries that have done it differently.
No, you don't.
You can't come up with... I asked him to come up with an objective diagnosis of the presence of this force in his body. That's not an objective diagnosis. Yourself is the reverse of objective.
Myself and 10 million other alcoholics and addicts across America and across the world are having these problems.
But people have problems with drugs and drink. People like taking them and they don't want to stop taking them. But it doesn't mean they have a disease that needs to be treated.
So the American Medical Association is wrong in your opinion?
If the American Association says it's a disease, yes, of course they're wrong. There is
all
an
these
immense
doctors
fashion
are wrong.
at the moment.
But you're right.
There's an immense fashion at the moment.
But you're right.
There's immense fashion at the moment for dismissing the ability of people to take control over their own lives and to make excuses for them. We have, far from 50 years, been treating alleged addiction as a disease, as a crime. We've been treating it as a disease, and the result is we have many, many more drug users than we did when this policy started.
The medical evidence shows that addiction is in part a genetic problem and in part an environmental one. If you've got parents with an addiction, if you then have abuse, sexual abuse, child abuse, you'll be brought up in a children's home, lots of foster parents, you've got this genetic problem anyway. The evidence is very, very clear. You have a health problem. And countries that have addressed this and dealt with it as a health problem are doing a lot better than we are. We can save money, we can reduce crime, we can get people better, stop having them on benefits, we can have them paying taxes. If we want to save money and help people, then we know how to do it.
Since we've followed your policies, more and more people have been taking dangerous and damaging drugs. Since we've ceased treating drug possession as a crime and have more or less ceased either arresting or prosecuting people possessing drugs. Since we have classified drug takers as people with a medical problem, we have had more and more of all of them.
Let me ask you
Can that
this,
possibly be right?
Can I just give him one quick put down?
If you want to, you go ahead.
You're making a point that is as ludicrous as saying that Peter Pan was real.
Well, you keep saying that, but you cannot come up with an objective definition of the thing which...
I was going to produce an argument that may be useful to you, Peter, which is this, that isn't the point about drug courts that people have to be compelled to get clean? And that in itself tells you something.
Yes.
They don't have to be compelled.
Well, they have to be compelled. You have to have the will. You have to have the willingness to change.
Yes.
Drug courts don't do much better than voluntary treatment. Drug courts do fairly much the same.
That's not true either. It's not as crazy as what he's saying, but it's not true either.
Well, there is research evidence to show that you do as well, roughly, with voluntary treatment as you do in drug courts. But actually,
they've got to want to do it.
They have, and to be well enough to do it,
and that is an act of will.
but they've got to have reached a stage, have sufficient support, sufficient treatment. No, this is very complicated.
And
it's
they have
not
to be
just
cleaned
a
up.
simple
They have
thing.
to be
It's just
sober.
willpower. It's much more complicated.
They have to be
than that.
sober to make that decision. They can't be. They can't be intoxicated to make that
How is
decision.
it that people ever cease to be addicts if what you say is true?
Well, Santa.
It's terribly clever, but this is a very serious subject, and you treat it with immense levity.
No,
how is it that if what you say,
you're the one
what
that's
you
treating
say,
it
the
with
policy
levity.
which you so smugly and loftily advocate, this policy which has led to disaster in Western countries for decades. How is it that if what you say
How
is
is the
true,
policy led to disaster?
how is it that people, because it has led to a laxness in the law which has meant many more people taking the terrible risk of taking the drugs which you say are addictive and we all agree are damaging?
That is simply not true, and we know it, and the research shows it.
Yeah.
Quite simple. All you've got to do, Peter, is a bit of reading of the evidence, and you will
Read
find
something other than your book.
Okay, all right, that's enough.